Hi, good evening, everybody. So I'm quite excited because I love the topic for tonight, which is, of course, back pain. So the things that I would cover in tonight's live stream is I'm going to first chat to you about the back, how the back's put together, the anatomy, everything that makes it up. Then what happens when you injure it? What are the different things that you can strain, and when should you be worried? When can you just carry on? I'll look at two different main categories of back pain. What happens when you acutely injure your back? So, like for instance, I pick something heavy up and I strain my back today, versus if you've had back pain for quite a long time, so more than 3 months. And then lastly, I'll take a look at exercises and things you can do to help your back pain. Welcome, my name is Marika, and I'm the physiotherapist at sportsinjuryphysio.com. If this is your first time here and you would like to learn how to stay injury-free, make sure to subscribe and hit the little bell so that you don't miss any of the updates. Back pain. Let's look at how the back is put together. Our spines are formed by your neck or your cervical spine. That's made out of it's made out of 7 bones. Then you've got your thoracic spine where the ribs come and attach. That's 12 bones. And then we've got the lower back, the lumbar spine, which is made up of 5 bones. So I'm going to talk mainly about the lower back today, but most of the information will actually apply to everything. So we've got our vertebrae or backbones stacked on top of each other. Then in between them, you've got little cartilage plates called discs, and they've got a harder outside and a slightly softer inside, and they are mainly there for shock absorption. Then also where the bones sit on each other, they've got the discs, but they've got little joints on the sides of the disc where they're called saddle joints or facet joints. And if you've had back pain in the past, you may have heard that word mentioned. So the facet joints are just little joints on each side where they can either slide on each other forwards and backwards, or depending on the part of the spine, they can also slide on each other like that. Okay, then you have ligaments connecting your bones together, quite strong ones actually. And then, of course, you've got all your layers of muscles, and we've got deep layers of muscles, like for instance the multifidae muscles, which are mainly there to stabilize because they run from one vertebrae to another. And then you've got your big fat back muscles as well, which are mainly there for moving the spine. But all of them contribute to stability of the spine. Then you've got your spinal cord coming down the middle of the vertebrae or the backbones, and that gives us little nerve sprouts that at each level where the bones stack on top of each other, there's a little hole each side and a nerve comes out of that side. And those are the nerves that supplies your muscles, your skin, everything that happens in the body. Now, what happens when you injure your back? Well, the easiest way to think about this is to think about what happens when you sprain your ankle, because the back is really just another joint like the ankle joint, except you've got loads of little joints stacked on top of each other. So depending on the injury, you can either sprain a ligament, you can pull a muscle, you can injure the disc, you can sometimes the nerve can get injured as well, or more often actually the other things that's injured, the swelling from that irritates the nerve. You can sometimes break a bone. That's not really common. It takes a lot to break a bone in your back. I'm sure I'm missing something out, but those are the main things. In truth, what I see in practice is that most people sprain their backs in that they annoy all of these structures in a small way. I don't see many. Yes, of course, we get severe injuries in, which is a little bit more serious. But most people, I would say 85% of people I see in clinic, have just gone and sprained their backs. So try and think of it as a sprained ankle. Now, you wouldn't expect to be able to run on a sprained ankle within 3 days after spraining it. That just wouldn't make sense. But it's amazing for me how people get really, really worried if their back pain hasn't settled within about 3 days. So the first important thing I think I need to bring home tonight is that our bodies take time to recover, and it takes a lot longer than what people normally expect. people or my patients are often quite surprised when I explain to them that a normal calf tear takes a minimum of 4 weeks to recover. And that's a simple one. If you've done a proper job of a calf tear, that can take anything from 8 to 12 weeks and even longer. So you can see how to expect a back to fix itself within a week is quite optimistic and doesn't really happen. The second thing with that is to remember that, or maybe not remember, what I would like to actually, one of the myths that I want to bust tonight is, you know how people say, oh, you can just click my back in because something's definitely gone out. It's so sore, something's gone out, you've got to click it back in. You know what? If something's gone out, your back's dislocated and you're in real trouble. That doesn't really happen. What happens is when you sprain your back, you get little tears in your muscles, little tears in your ligaments maybe. The disc can have a little tear, bit of inflammation. That's not a problem. There's nothing that any clinician can do to pop your back into place, okay? So yes, they can give you a good old crack, but that's not going to fix the injury. All of those structures have to form new. First of all, they've got to get rid of the damaged tissue. That takes between 3 and 5 days, sometimes a bit longer if you've done a proper job of it. Then you've got to rebuild new muscle fibers, new ligament fibers, new fibers for the disc. And that can take up to 3 weeks. And then those new fibers have to be replaced by stronger fibers. So the first ones that form are quite weak. They're a little bit, if you remember the first talk I did in this series of 4, it was all about how injuries heal. It's really worth going to watch that again, but I'll recap it quickly now. So the first fibers that form after an injury are kind of just put down in any old way. It's like a bowl of spaghetti and it's not very strong. And they have to realign so that they're parallel and nice and strong. And they've also got to be replaced by bigger, stronger fibers. And that counts for muscles, tendons, whatever you've injured. And that process can take anything from, again, 4 weeks, but usually for backs, I find it's usually closer to about 6 to 8 weeks. And then if you've really done a proper job of injuring your back, it can take up to 2 years to fully settle down. That does not mean that you will be in the same pain that you are in today for the whole 2 years. What you want to see is that it slowly improves over time. You'll have a few setbacks. That's normal. All injuries does that. But the value is, if you work with somebody who can help you identify what you've done to upset it, you can learn from it and then not do it in the future. Okay, so, I see Ahmed said if we can talk about sacroiliac and back pain. I'll definitely look at that, Ahmed. Hi, Shayla. I'm glad you could join us tonight. Okay, so that's the first point, is if you've injured your back, it can't be cracked back into place. It needs time to heal. Now, the second thing is, and I hope you've heard this by now because it's been all over the media, is that when you've injured yourself, to keep moving. You do not go and lie just still for 2 weeks and hope that everything's going to be better. Hi, Trevor. Welcome. Glad you could join us. That's not useful. If you keep moving, you actually help your circulation and you recover quicker. But that doesn't mean that you can do senseless moving, because you don't want to strain the structures that's a little bit weaker and that needs to recover now. So it's really useful to work with somebody who's trained in treating backs and things to get some guidance if you're not sure. But in all honesty, it's not rocket science. It is often you've got to follow your gut feel. So sometimes when people injure their backs, they find that sitting is really uncomfortable. So then they go between lying down for periods of the day, sitting a little bit and walking around. And that's perfect because they're getting all the movements in. If they force themselves to sit, and that's actually the part that doesn't feel good for the back, then they may increase their pain during the day. So going between positions is often a very good solution. You will feel worse first thing in the morning when you get up. Don't be alarmed by that. The main thing, or the main reason for that, is that when you lie still for a long period of time, the inflammation and all the chemicals that's formed through inflammation has time to accumulate. And because your circulation's down, because you're not moving, it gets to the point where it feels really, really bad. So have you ever noticed that first thing in the morning you go, I cannot possibly move. I don't know how I'm going to get up. Often you've got to kind of kneel to get up. But then as soon as you've been busy for about 30 minutes to an hour, you've loosened up and you can actually move. And it's purely because you've helped your circulation and you've allowed your body to, or assisted your body to get rid of the inflammation and swelling that's accumulated during the night. So that would be a good thing to remember. If you've got an injury that you've, or something that you've injured in the last 5 days, don't be alarmed if you're really stiff first thing in the morning. That's quite normal. What you want to see is that the general day starts to get easier over time. Another big thing with backs is that they often are quite sensitive for what you sit on once you've injured them. And the reason being, most of us injure our backs with a bending movement. So it's either you've reached sideways or, you know, pushed something along those lines. If you sit in a chair that's quite soft, or a sofa is the classic one that allows you to sink in, can you see if I sink into something, it's essentially as if I'm doing a similar movement to the one that sprained the back. Thinking of the ankle sprain again, if you've gone over on your ankle, you wouldn't expect that ankle to be happy in that injuring position within the first few weeks after doing it. So that is why it is painful to sit on very soft or slouchy surfaces after you've strained your back, because it actually just strains the tissue that you've gone and injured. So what I usually advise people to do is play around, because different people's backs prefer different things. But usually if you have it doesn't have to be rock solid, but a firm surface to sit on, and something where you can definitely support your lower back. So putting cushions or something into your lower back, or a very good office chair if you have to sit. But definitely look at what you're sitting on, because if you're uncomfortable while sitting, it's probably not the best place to stay there for too long. It's not going to make your injury worse. It's just going to keep your pain cycle going. Okay. Then the fourth thing before I get to exercise for backs that I want to highlight is that injuring a back can often be quite a scary thing. We all know somebody who has injured their backs in the past and not recovered from it, and is really suffering with it now. And it's quite hard not to go through that thought process of, oh my word, I'm never going to be able to be without back pain again. But honestly, you should not listen to anybody else's situation. Everybody's different, especially if they've injured their backs more than 10 years ago. To be honest, 10, 20 years ago, we didn't really understand how to treat back pain effectively. I've seen patients who in the 90s were put in full body plaster casts, where they weren't able to move for up to 6 months, I think, the one guy, and he's got a terrible back now, but it's because he had the wrong treatment back then. Whereas if he was told to move, he would have likely been in a better situation, and luckily we now understand that you've got to move. So that's the first thing. Don't get petrified when you injure your back, because your situation is not the same as the other person you know who's got a bad back. Second, with regards to that, is go and consult somebody that you trust, that you've had a recommendation from somebody else who can help you identify what you've got to do to get your back better. Now, what I would say, because it's quite difficult sometimes to find the person who you trust to help you with the right advice, because you don't know. A couple of points. If the person you see does only passive treatments, so they're slapping electrotherapy on you, they're doing acupuncture, they're doing massage, those things aren't wrong and it really helps for pain. But if they're not giving you a plan of action of what exercise you can do, how you should sit, what activities you can do during the day, they have to give you a self-management plan as well. If they're not doing that, then I would look for somebody else to help you, because you don't want to become dependent on a clinician who just wants you to pay every week to come and see them. Because you know what? After 6 weeks, your body is busy repairing itself, as long as you're giving it the things that it needs to repair. So for anybody to say you've got to come in weekly, pay them this for 12 weeks, if you just followed good advice at home, you would have arrived at the same point. You don't need somebody to be poking at you for that time, but that's my piece set. What is going on here? Oh no. Has this thing stopped streaming? Oh dear. Can I get an indication that anybody is still seeing me? Because Facebook has just decided to throw me out. What is going on here? Okay, so... Oh, okay, great. Shella, can you see me as well? I'm going to decide that you guys can see me as well as hear me. And I'm going to continue because my computer has just gone weird. Okay, perfect. Thank you, Trevor. Okay. What I'm going to do... I've got myself in my ears now, so this is very weird. But anyways, we'll continue. Okay, so let's go on to what do you do if you actually injure your back? The first thing is don't panic, okay? Unless you're getting severe symptoms down the legs and things like that, it's really not necessary to go and see anybody about it immediately. The best thing you can do is stop doing the activity that you did to injure it and just take things easy. If you find that you can walk, then definitely walk. If you find you can cycle, then you can cycle. Depending on the injury you've got, it may allow you to still do things. I'm just going to have to see if I can get rid of this voice in my head now because it's driving me nuts. Sorry, guys. I wonder if... Yeah, never mind. We'll go along with this. Okay, so the first thing is keep active. So walking or cycling, something that's gentle, or swimming if that works for you, but it's got to be pain-free or a little bit of discomfort, and you shouldn't be worse off afterwards. But don't expect that you can go and do the rowing machine or burpees or things like that. Think about it as you've sprained your back, so you've got to take it easy that the sprain can have time to recover, but as long as you don't put pressure on it directly, you can still get away with whatever you want to do. Then also, the first week is likely not the period to jump into strength training. You've got to give it time to just gently recover. You can improve your range of movement through gentle stretches, but again, you should feel better after you've done it, not any worse. So if it's not ready for stretches, leave it for the second week. It doesn't all have to happen immediately, as long as it happens eventually. Then people used to traditionally think that exercise like Pilates or yoga is the best thing for backs. But actually, the research is now coming out to show that things like weight training can be really, really good for it, because you can get proper muscle bulk from it, and it works for people who find Pilates and yoga really boring. So whenever you do exercise in the gym, weight training type things, so I'm talking about squats, I'm talking about deadlifts, I'm talking about any arm exercises, anything like that. If you are bracing your core in the correct manner, then you are strengthening your back. So that's why personal trainers are always on about your form, because if your form is right, then you're actually activating your core and strengthening it at the same time. If, however, you're not using good form when you train with weights, then you are just straining the wrong muscles and your back. Okay, so let me just get myself there. So to recap, if you injure your back today, take it easy for at least 3 to 5 days, but stay active. Do exercise that doesn't hurt it. It's low impact when you go back. You shouldn't expect to be able to pick up the same weights as you were able to. You try to go without weights first, just body weight exercises. As soon as you can do that pain-free, you then start adding in gentle weights. But try and just put it out of your mind what you used to be able to do. You will get there again, but you've got to build up to that, because remember, the small fibers that's being formed needs to be replaced with nice strong ones. Okay, so that's for acute backs. Now, what about somebody who's had back pain for years? You know what? I've actually seen people get rid of back pain that they've had for years and years and years through strengthening their backs up. So what often happens when you get an injury, you start favoring it. And if you start favoring it, you stop using your muscles, you stop using that body part, and everything, all the muscles that surrounds it becomes weaker. So now the joints have to take more strain, and they move in a way that they shouldn't move necessarily. And that often keeps the pain cycle going. Also, sometimes it's silly things like their favorite way of sitting on the couch, because they like to sit with their feet up and slouch into that. And then they wonder why they get up and have back pain afterwards. And on that point, the funny thing about us humans is, or maybe it's just us in these days, is that we expect our bodies to be able to do everything without it causing us problems. And then when it does cause us problems, we're kind of taken aback. Let's go back to the couch again. Slouching on a couch may not be a problem for a lot of people, but for a certain type of body type, or with somebody with certain injuries, that can be enough to keep the pain cycle going. Now, we all go through a stubborn period where we go, but I will sit like that. But you know what? If it consistently makes your pain feel worse, you're just being silly. Because if you stop doing that, it may calm down enough that you can actually be pain-free. So go and have a look at what your pain pattern is. If you've had back pain for a long period, but you have good days and bad days, it means that some days you're doing stuff that it doesn't like. The second thing is definitely strengthen up, but I would advise you to see somebody who's good with either prescribing rehab programs or a personal trainer that you trust, that you know is sensible about exercising people who are injured, because you likely need a little bit of guidance on doing things with proper technique. But honestly, if you strengthen up, some people will get rid of their pain totally. Others, it may decrease to a point where it doesn't even register for them anymore. So I'll totally admit that some people won't get rid of all of their pain, but everybody usually improves. It's just about finding the type of exercise that works for you. Okay, so let's have a look at some of the questions that's come through so far. Now, there was a question about sacroiliac pain and back pain. So for sacroiliac pain is basically, for those of you who don't know, it's your lower back stop, or your lumbar spine stops there, and then your sacrum is this bit there. Lower back pain and sacroiliac pain often goes together. The best exercises that I find that help for both of them is if you can strengthen the glutes up, because guess what? They come onto the sacroiliac joints and their fascia crosses over the lower back. And also, if your glutes are really strong, they'll take more of the strain when you're bending and things like that. And then also exercises like that incorporates the back as well as the glutes. So things like squats, things like deadlifts, bridges, all of them are really, really good. But you've got to start at the right level for you. Okay, what other questions have we got? How to differentiate between inflammation and degeneration. Okay, so those are quite loaded words. Inflammation is a natural part of the healing process. When we get injured, you have tissue damage, so you always tear little cells and things. It's not a problem. The body gets rid of it, and inflammation is how it does. It comes in, you've got cells that comes and eat the damaged cells up. So I would say that in most cases, if you're thinking of an injury that you did today, you can say that inflammation is part of that injury recovery period for the first 5 days, maybe 7 at a stretch, and after that it's less and less. Then the tissue is usually just sensitive. Degeneration, that word is quite a nasty word and makes people really, really worried. So unfortunately, all of us have a bit, let's call it wear and tear. We use our joints. They're not as pristine. I'm turning 40 next year. So if you looked at my joints versus somebody who's 16, then my cartilage won't be as nice and smooth. I'll have little extra bony bits somewhere. But the interesting bit is you don't have to worry about that. That takes me actually to scans as well. So what they've done is, when MRI scans was invented, we thought, yes, now we can scan everybody and we'll know exactly what's going on with their backs and we'll be able to fix it. Problem is, then they scanned loads of people with pain and they got all of these scans. They went, oh, disc injury, blah, blah, blah. We've got to go in, do surgery, fix it. Then they scanned loads of people who didn't have pain and they found that they had the same injuries on the scan. And they went, okay, well, this is now a little bit of a problem, because why do one lot of people have pain with this type of injury and the next one doesn't? And that's where, I don't know who saw the placebo thing the other day on TV. What we've realized is that pain is, yes, there's some pain being created in the tissue that signals to the brain that there should be pain there, but essentially pain is actually created in the brain. It's about how dangerous your brain feels an injury is. That's how much pain you feel often. It's not a conscious thing that you can do. It's not that you can think, oh, I'm not going to have pain now, it's going to switch off. It doesn't work like that. Your subconscious does not trust your conscious mind. It's forever trying to look out for you and trying to protect you. But what we know is that sometimes that protection becomes overactive and too good at protecting you. And that's when we end up with pain that doesn't actually switch off. So for anybody who's had pain for longer than 3 months, I would say that you can be pretty sure that your initial injury has 90% healed. The pain that you get from that is just your alarm system being overactive. But now that doesn't mean that you can go and exercise through the pain. You're not doing damage, but you're setting off your alarm system more. And what alarm systems does then is create more pain and more intense pain to the point where it actually affects the rest of your life. So what I want to say is, don't worry about degeneration, if that's the word you want to call it, or wear and tear or whatever. If you keep yourself fit, if you identify the things your back likes and doesn't like, and if you strengthen your muscles up in a sensible way, then you do not have to have pain, okay? And sometimes it does help, or often if you've got a tricky back that you feel that you just don't know which way to go, it really helps to find somebody who is experienced in helping people recover from this. Okay, so that's a very long-winded answer to that one. Good, loads of people saying they can hear me. That's good. What is the best? A plank or bridging, and why? Okay, so plank or bridging. You know what? There isn't something like a best exercise. There's just an exercise that is right for the part of your rehabilitation or strengthening that you're in. I use bridges a lot, especially at the beginning of strengthening people up, because it's a lovely way of activating the glutes. So for you guys who don't know what a bridge is, it's you're on your back, feet, knees bent up, and you're lifting your bottom up. What I like about that exercise, it's a position where people feel safe. You can get the glutes really activated. You can get your back muscles activated. And you can also, if you include a spine curl with that, you can start to teach people how to move their spines in the correct sequence. Planks, there's a lot of argument in the physio world at the moment about planks is not functional, planks should not be used. You know what? I still give out planks now and again because, one, they definitely get loads of muscles activated. And sometimes that is all a person can do at that point. What I like about them is they incorporate the upper body as well, and they get you to just stabilize things in a more kind of in a different position. So I think what you need to do is when you want to use a plank or bridge, think about what is the reason that I want to use that. If you can stay in a plank position for a minute or so, I would probably argue that it's time for you to move on, to make it more difficult, because then it's not challenging enough. And that's the other thing with a back exercise program is at the beginning, it's all good to have it nice and easy and get the range of movement first usually, but you have to bring in strength training of some sorts. Now, whether that is Pilates or it's weight training or it's training with a personal trainer, yoga, whatever your preference is, you have to start strengthening the muscles up. And when I say strengthening, I don't mean big weights immediately. I mean build up to that. But if you're staying on the same level of exercise for 6 weeks, you've adapted to it and it's time for you to strain yourself a little bit harder. So Shayla says, when I do a plank, it hurts my back. Well, to that one, I would say that either you're not engaging your deep core muscles properly, or you're already tired at that point and you're just losing a little bit of your form. It's really easy to keep the plank there for ages, but without stabilizing in the proper way. Maybe I can add that in a little bit. So when we talk about core muscles for the back, does anybody actually know what the core is? What makes up the core? Everybody knows about tummy muscles, but actually I think the ones that people think of are the wrong ones. So it's not the six pack that you can see. Your core is made up of your pelvic floor at the bottom. Then you've got the diaphragm at the top. You've got your deep layer of stomach muscles, which is your transverse abdominis. And then you've got your deep layer of your back muscles. And they all have to contract together to kind of brace your spine. And the easiest way to start practicing that contraction is, I find you've got to be lying on your back to get the initial contraction, but it's to get your pelvic floors activated. So I want you guys to try this. Now, this is a bit of weird talk though, because it's pelvic floors and you're going to hear words like wee and fart, so I apologize. Your pelvic floor muscles, you've got two parts to it. You've got the front bits that stops you from wetting yourself, and you've got the back bits that stops you from farting in public. So if you want to activate them, you can think about just tightening up everything down there to stop yourself from weeing. Or you can imagine that the queen is in the room and you want to fart, but you can't fart because she's in the room. So you tighten up the muscles around your bum hole to make sure that you don't fart. But now check, are you also tensing your bottom? Because that's not supposed to happen. It's meant to just be the muscles around your bum hole. See if you can tighten that up, and also the front bit, but without bracing this bit and without squeezing your glutes. Okay? If you can do that, hold it for 10 seconds and just breathe. Okay. Can you do that? Can you still breathe normally? And relax it all. So the big thing is to be able to activate those muscles without doing that as well. So next time that you're in a plank, see if you can really activate those muscles and keep them in, and just take note of what happens to your back. But usually when people get trouble in the plank, it's because they're either not stabilizing enough or they're tired and they're losing their form. Any other questions? Okay, so we've got the effect of abdominal strength in rehab. Abdominal strength is really important, but what I would say there is abdominal strength on its own is pretty useless. When you think of abdominal strength, you've got to incorporate the pelvic floor as the first thing you've got to get. People have to be able to get the pelvic floor active and keep that nice and engaged without bracing everything else, because that starts to give you the stable platform to work from. So that is always, doesn't matter what type of condition I treat, even if it's a knee injury or an ankle, that's where you want to start. Okay, then, is there any exercise I can do to help a troublesome disc in back, which is aggravating a nerve? Okay, so what I would say to that is, yes, it's maybe, Eleanor, if you can also just comment, what exercise do you do at the moment? Because that can help me comment a little bit more specific for you. But the big thing with discs is definitely check what surfaces you sit on, because often that can irritate a disc, and then when you do exercise, that just compounds it. What I would want to do is I would probably start you off with glute bridges, because if you think of it, it strengthens you into that position, and discs usually don't like being stretched. They don't mind being squashed. So I would start with things like double leg glute bridges. Again, making sure you're engaging the deep core muscles, so the pelvic floors and everything. Okay, so you're doing running, Pilates, and Tai Chi. Those are all great exercises. Now, if you sometimes don't feel good after Pilates, you've got to think about what it is that's aggravated it. So if you've got a nerve that's irritated, it may not like you stretching forwards with straight legs much, because if the nerve's not quite free to slide, that can sometimes aggravate it. So go and have a look at if you've got specific days where you feel better after the exercise versus others. Just see if you can identify what bits has annoyed it or not. If running is giving you trouble at the moment, you may have to hang back with the running a little bit until you've strengthened your back up a bit more. But you can also make changes with regards to how soft your shoes are that you run in, the terrain you choose to run in. But the Tai Chi is really great as well, because that makes you really aware of, okay, so it's more troublesome during the running. Yeah, the problem with that is that because of the running, the impact from that, often if you've got a disc that's irritating a nerve, it doesn't quite handle that so well. So you may have to stick with other types of exercise first for a little bit longer, get it to recover properly, and then go back to the running. But it's super, super important that you make sure that you do a proper program to strengthen your deep abdominals, strengthen your glutes, strengthen your quads, because they are all meant to absorb the shock from running. I'm going to pull a number out of the hat here, but I think your quads are meant to absorb something like 60% of the impact from running. I may be totally wrong. So yeah, I would really go back to basics. Work on pure strength for your legs, good strength around your pelvis and your abdominals, and then go back to running. And maybe just play with your running style as well. Should you be keeping your strides a little bit shorter, that you don't have quite that hard impact? Should you stay away from doing downhills, because again, that's quite impact? Analyze that all and see how you can change it up that it works better for you. I hope that answers it to an extent. Okay, so are there any other questions, guys? Otherwise, I'll answer them in the comments afterwards for you. Good. Then to recap, don't get stressed out if you injure your back. Don't be too worried. It's pretty much like a sprained ankle. Be patient. Backs take a long time to get better, but all injuries in the body takes a long time to get better. It usually takes between 6 to 12 weeks, depending on what you've injured. Find somebody to just give you a bit of guidance with regards to strengthening exercises and things that are right for you. But the main thing is keep moving. Choose movements that doesn't cause you pain during or afterwards, especially in the initial stages. And then as soon as you're ready, go on to strengthening stuff. But likely stay away from things that is too high, that's high impact, or involves a lot of moving of the back. So usually start with just more stable exercises first. Thank you for watching. If you would like to learn more about preventing sports injuries, make sure you hit the subscribe button. See you next time.